Hi guys, so we've got chemotherapy round 4 coming up tomorrow. So I'm back at the hospital again. I am going to have my blood work checked out to make sure that my red and my white and my placets are all good and ready to go for another bashing.
Oh, look at you.
Hi, how are you?
A vision in pinkness.
Thank you.
What's new and exciting? And even the matching purse and matching phone and matching case. It's just, you're all like swing.
Thank you.
How are things?
Good.
What was this last cycle like for you?
Well, it was a little bit worse than the other ones, but not totally. I mean, it's manageable.
Okay.
Yeah.
What made it worse?
So the mouthwashes which I had the last time, which weren't too bad, they were a little bit worse this time around.
Okay.
Like just where my teeth are.
Okay.
And then they went like backwards up to the root of my mouth.
Okay.
They do die down after like 3 days. Like the first time I had them, they died down I think quicker than like, and this time they lasted a little bit longer.
Okay.
Also, I had a problem with sleeping, where I was like, and there was that one time that I told you about where I was up until 4 o'clock in the morning, but this time it was happening over a few days this time.
Okay.
So I want to say it was the first week I was struggling, like staying up until like 3 o'clock in the morning, and it was just frustrating.
Yeah.
And what else? A little bit of sickness. Where I was heaving a little bit, but nothing was coming up.
Okay.
So yeah, it was just like weird things like that, but they weren't like the sickness or anything wasn't severe.
Okay.
But the nausea drug that I did take didn't seem to
Really be
do much.
Yeah. And
it was manageable. Like, because my husband was going, "Do you feel nausea?" I'm like, I don't know. I just feel kind of like my belly was just odd. And then I was like, I was heaving. So when I was going to the toilet and stuff, the smell of it was just making me like, I don't know. It was weird.
And it's hard. The protocol that you've been on is what I describe as our pukey protocol.
Yes, you said that.
It is the most prone to cause nausea.
Yes.
The good news is we're moving on to something
the other
different,
one,
which is way less inclined to cause nausea issues.
Okay.
So we're going to give you new pre-medications to help with the new cycles.
Yes.
And let's talk about Docetaxel. I think many of the issues that you had with the first 3 cycles, sometimes they can continue. I'm going to give you a prescription for the mouthwash that's got a bit of a numbing agent in it.
Yeah, because I had to use Listerine in the end because I was sorry. It was like the only thing I had. Yeah. So it was like, no. I should have probably phoned you.
Yes, you should have. I will not beat you, but you should have phoned me.
Yes,
because that's why we're here, right?
And you've been really good.
Well, and I'm happy to help you.
Yes.
The CCI mouthwash that I'm going to give you has got a numbing agent in it. It's got an antibacterial. It's got an antifungal. Because those ulcers can be a place for infection to get into your body.
Yes.
So it's important that we heal them up as quickly as we can.
Okay.
This mouthwash, you're going to get, your pharmacy will have to send it to a compounding pharmacy to get it made.
Okay.
Because they have to crush up medication. It takes time to get it, so drop it off today and figure that out.
Yes.
It has to be stored in your refrigerator. You have to shake it before you use it because the medication will settle to the bottom.
Okay.
It does not taste great.
Okay.
But your taste is screwy anyway.
Yes, so you're right there.
It'll be fine.
And it's really just the first few days, so yeah it doesn't, yeah.
I'll also give you a prescription for something for sleep.
So with the mouthwash, am I just swishing it?
Swish it around.
Not gargling, because if I swallow it.
You can swallow it.
Okay.
Because whatever's going on in your mouth is likely going on in your throat as well.
Okay.
So you can swallow it. Some people don't want to. They feel it's gross. So you don't have to, but you can. It's not going to harm you.
Okay.
What it does is it numbs things.
Okay.
So you need to wait for at least 20-25 minutes before you drink or eat.
Even water?
Even water.
Okay.
Because the water will wash it off. You want the medication to soak into the tissues.
Gotcha.
And if it's numb and you ate something right away, you could gag on it. You could choke.
Oh, okay.
Because it's like you've gone to the dentist and everything is numb.
Right.
Right? So you want the medicine to soak in and do its job. And by 20-25 minutes after you've used it, generally you're able to drink and eat without difficulty.
Okay.
Okay?
Okay.
So I've got the prescriptions out there. Kristen's going to come in. She's making you a schedule of when to take things.
Okay, brilliant.
Okay. So Docetaxel is a single chemo agent. You've been on a combination of 3 drugs in the first 3 cycles.
Yes.
Now these cycles will all have just 1 drug.
Okay.
Okay. It will be a shorter time to infuse than taking the 3 drugs.
Yes. Do they have to manually do this one like the last ones,
No.
or is it literally on the drip? Okay.
It's on the drip. But they're going to keep a pretty close eye on you. There are 3 serious things that can happen with this medication and a whole bunch of annoying things. So let's talk about the serious things first.
You're worrying me now. Stop it.
So, serious things. Number 1, there is a risk that you could have what's called a hypersensitivity reaction, or like an allergy,
Okay.
when you're getting the chemo going in.
Okay.
It happens to about 3 women out of 10. That
Okay.
means 7 women out of 10 have no reaction.
Okay.
It happens on the first or second time you get the drug.
Okay.
What you would experience is you might feel all of a sudden, I'm flushed. I feel like my skin is red or pink. I feel itchy.
Okay.
I have a sudden cough.
Okay.
Rumbles in the jungle. Gotta go to the bathroom now.
Okay.
Those are very common things that people experience. Or you might just say, I am all of a sudden not feeling the way I normally do.
Okay. Tell them straight away.
Tell them straight away. The nurses may know before you do because they keep a very close eye on you.
Okay.
If that happens, they pause your chemo, they whop some Benadryl into the IV, and 99.9% of my patients go ahead and get their chemo the same day.
Okay.
It just slows down the process.
I think it happened to my friend just recently because we're kind of both having chemo right now, and I think she had a reaction to it, and they sorted it out, and she was fine, and had it 30 minutes later.
Yeah.
Okay.
So it's not uncommon for it to happen, but it's something that we deal with all the time.
Okay.
I give you a bunch of medications to prevent it from happening.
Okay.
If it happened, with the next cycle, I would give you Benadryl in the IV before you got the chemo drug.
Okay.
So we will do our best to prevent it from happening, okay?
Okie dokie.
So that's thing number 1. That seems enough. Thing number 2 is it can cause aches and pains.
Yeah, you said that.
So at the same time as your injection, we're going to continue with the injection. You're getting the needle after your chemo.
Yes.
So this chemotherapy is maybe a little higher risk for your blood counts being low. So that needle is very important.
Okay.
So we're going to continue with that needle, but it causes aches and pains. So you'll likely notice that more with this cycle than you have before.
Okay.
We talked about the Claritin and you took it with this last cycle, yes?
Yes.
So my suggestion would be take it for a full week this time.
Oh, like starting like now?
No, starting on the day of your needle injection.
Okay.
Because I anticipate that aches and pains will last longer. Because both of these medications, the chemo and the injection, both cause pain.
Okay.
Do you have other pain medication at home to take?
Like what?
Like codeine or tramadol or anything from after your surgery?
I don't think so.
Okay. And do you have any drug allergies at all?
No.
Okay. Codeine is generally our first go-to medication. It is a weak opioid. I like to use the weakest drug that will do the job. And for most of my patients, it's very effective. You can take 1 pill every 4 hours.
Why do I think I might have one of that? I don't know. I don't know if I do or not. I think he did give me some of that after my my surgery.
Okay. What I can do is I can give you a prescription today.
Okay.
And you can just park it in your pharmacy. Take
Yes.
it there, drop it off.
Yeah.
And if you've got medication at home to use already, you can use that.
Yeah.
Most likely, if you got it from your surgeon, you might have tramadol. Tramadol is a medication that you take every 6 hours.
Okay. I have no idea at the top of my head.
Okay.
Yeah.
Okay.
You might as well just prescribe it, so I just got it.
Okay.
Yeah.
I'll give you codeine, because codeine is what we generally use. You can use it.
And you can't get addicted to it unless you're taking it, unless you don't need it.
You're going to be using this because you have pain.
Yes.
And when your pain is getting better, you're going to stop taking it.
Yes.
And maybe just use Tylenol.
Yes.
People have problems with developing tolerance for medications if they take it when they don't need it.
Yes.
They take it because it makes them feel good.
Yes.
That's not going to be your situation, because if you're taking this medication, you're taking it because you don't feel good.
Yes.
Okay? So I am not particularly concerned because I will be monitoring you while you're on this medication.
Yes.
I tend to tell people when you feel like that you don't need to take the codeine, don't take it.
Yes.
And take Tylenol.
Yes.
Check your temperature first, but take Tylenol because it's often more effective for the type of pain.
So the whole thing with the temperature thing right now, is that, can that happen to me within the whole 3 weeks?
Yes.
Or is it only, because I always seem to think it's just for them 4 days, do you know, like when I'm feeling rough.
Yeah. You could have a fever at any point.
Okay.
So we always want you to check it for a temperature that's elevated prior to taking the Tylenol.
Okay.
Okay. So in terms of pain management, the pain from these medications tend to last between 3 and 5 days.
Okay.
For most people, it's fairly manageable. Using the Claritin should help to reduce that pain.
Yep.
Using the codeine as required. Codeine is good and evil. It's evil because of constipation. Because most people, if you're taking lots of codeine over time, they tend to get their bowels slowing down. So you have to stay on top of that.
Yes.
Okay. When we think about the side effects, those are the 3 biggies. The risk of a reaction, the risk of increased pain, and the risk of low blood counts, needing to take that needle the day after chemo to get your blood counts elevated. The rest of the side effects are annoying, but not life-threatening. Okay? Your tear ducts can be irritated with increased tearing, dripping down your nose, running down the back of your throat, which can cause you to have a bit of a cough. Eye drops can be helpful for your eyes. If your eyes are running all the time, they're actually probably not well hydrated. They may be quite irritated.
I did find a runny nose this time as well, and I don't know whether it's because I've lost the hairs in my nose or something like that, and crusty on the inside, so it's build up of like, you know, the mucus.
Yeah. So you can use a nasal spray like Rhineris.
I was using a nasal gel.
Yeah.
I can't remember, again with an S or something. I can't remember.
Sacaris?
I think that's
That's my other option. So
yeah,
that's fine, and that's what I would recommend.
Okay.
So continue on with that for the nose.
Yes.
Eye drops, something like Refresh or Sustain, are the 2 products that we generally recommend.
Okay.
They work quite well. They're easily tolerated. I say that the Refresh eye drops make my eyes feel slimy, which is actually good. When they're feeling gritty and dry, you want them to kind of feel quite well lubricated.
Okay.
You can have changes to your fingertips and toe tips in terms of tenderness.
So that's a neuropathy.
Or
is that different?
It's part of neuropathy.
Okay.
So neuropathy can present as tenderness or as numbness or as tingling.
Okay.
And that tends to get worse as we go through the chemotherapy. So we keep an eye on that. Every time I see you, I will ask, any numbness and tingling? Is it affecting your daily life? Do you find that you are dropping things? Are you having difficulty doing activities?
I do have the ice packs, and you know, for the hands as well as the feet.
Perfect.
I've got them already.
Perfect. So you want to chill your fingers and toes during the Docetaxel. So a few minutes before, during it, and a few minutes after.
Okay.
And that can help to reduce that neuropathy.
How long is this session going to be then? Something around 20 minutes or something?
I think it's about 30 minutes. So
it's really quick then, because the other one was like an hour or something.
Yeah,
okay.
I think this will be shorter for sure.
Okay. Sorry, I got your train of thought, didn't I?
No, I go down my list of things. Fluid retention. By the time we get to the end of chemotherapy, you may notice that your ankles are puffy.
They're always bad.
Putting them up in the evening can be helpful. Going for walks during the day is also helpful.
I always have issues with the back of my calves and like anything to do with my legs.
Yeah. So walking is helpful because it makes the muscles work to push fluids back into your body.
Okay.
Lying on your bed, my physiotherapist says put your feet on the headboard.
Okay.
Because then you can passively drain fluid into your core.
Okay.
And you get a moment to relax.
Right.
So that's always a good thing, to have a little moment to relax. She likes that in the evening, particularly if they are feeling tight. That will get better over time. I'll ask about it all the time.
Okay.
Now we're on to page 2 of side effects. Hair loss.
Oh,
this may be the one that does your eyebrows and your eyelashes in.
I feel like my eyelashes are actually going.
Yeah.
I felt like my eyes were really tired, and I don't know, my mascara's not going on properly anymore, so. Yeah, they're already going, but the eyebrows, I would like to hold on to them.
Yeah,
now
I know.
They're going.
And it's hard to predict. This is the drug that will tend to be the one that does them in.
Okay.
Fatigue.
Can it not take my leg hair? Do you know, like arm hair, like anything like that? No? Just like all the stuff that we actually need.
You may lose all that stuff too.
Okay.
Fatigue because you're not sleeping well at night. Insomnia issues can be a bit of a problem. So
this is going to be an even bigger problem now.
It may.
Okay.
This is page 2. So these are less likely to happen, but can happen. Mouth sores, tenderness. So I'm giving you the mouthwash that you can use. That's often very, very helpful. Nausea is number 13 on the list. Like, it's way less common with this protocol than with the previous.
I think I'll take the aches and pains out of nausea.
And aches and pains, generally, we can do a pretty good job of managing. It's just a matter of staying on top of it.
Yes.
So I'll get you a prescription for the codeine so that you can have that.
So you're still recommending exercising if you can, and good diet, and
good diet. Do the things that make you happy.
Yes.
You know, still be cautious about being around people who might be sick because you're more susceptible to infection.
And I don't think I take that seriously enough, if I'm honest. I mean, I don't go to concerts and stuff, but you know, I go around not on the first few days because I generally can't manage it, but like in the second or third week I'll go to the mall or whatever. Yeah.
And do you wear a mask when you're in the mall?
Actually, I don't, and I should probably take it a bit more seriously.
I think I would, just because your risk of infection is higher.
And there's a lot of colds going on right now, and
there's a lot of COVID going on right now. Where are you at in terms of COVID vaccinations?
Oh, I've had both of them. Both vaccines.
So you can have up to 4. And right now they're doing the bivalent vaccine, so they've just released that. So that's the newest one, which is a combination of the original COVID and Omicron.
Okay.
So it is going to give the best protection right now in terms of a booster.
And I'm always worried because that second one I had knocked me. Yeah.
So, you know, it's always hard to predict how you will react to a booster. If you were looking to get one done, I would say aim to do it like 3 or 4 days before your next cycle of chemo.
Yes.
When your blood work has likely recovered to the most and you're feeling well. And that gives you a few days to recover before chemo. Because I don't know how you'll react to the vaccine, if you'll have a hard time or not.
Exactly. That's why I'm a bit dubious, if I'm honest. Yeah.
And I probably would not do it with this first cycle because you don't know how you're going to react to the Docetaxel. And you're likely a little apprehensive about that.
So the reason for the switch is just because that's the protocol.
Yeah.
Like,
it's because
it's got no extra effective on any of the cancer cells than the first round or...
So they've done a study where they compared chemotherapies. And they did 6 cycles of the chemotherapy that you were on the first 3. They did 6 like that, or they did the combination platter where they did 3 of effect and 3 of Docetaxel. This protocol was more effective.
Gotcha.
So it's a better treatment as long as we can use it. And there's some people who cannot take this second medication because they have some contraindications to the medication. You do not.
Yes.
So we want to use the most effective combination of medications that we can to give us the best benefit against your cancer. So that's this situation. Okay.
And how's my blood work?
Your blood work is, how would I describe it?
Perfect again.
Perfect again. So you are recovering well.
Yes.
Yeah. And, you know, I tell people this, you have a terrible advantage.
Because of the age.
Because of the age.
Yeah. Awesome.
So all looks well from my perspective.
Yes. So you're testing for the white cells, the red cells, the what's the P one again? Platelets.
Yeah, they're all normal.
I always want to say placentas or something.
Little bit difference between the placenta and the platelets. Yeah, a little difference.
And the liver.
And the liver and your kidney function. So all of that is...
So with my liver still showing up really good, like remember when you said the MRI, there was something on the liver. So I'm assuming that if there was something progressing there, it would show up on my blood work.
If there was if you had cancer in your liver, usually what happens is we start to see all of these liver enzymes become elevated.
Yes.
And not just one, but all of them. and yours are all completely normal.
Another question. So when I stop my chemo,
Yeah.
do you cease to exist and then I go over to a radiologist person, or do you continue on with me?
Am I transient in my corporeal existence? I'm still here. You're going to come back and see me in about 6 weeks after the chemo is all done. You'll be on your radiation at that point in time, and we're going to talk about...
How soon after the chemo do I start radiation?
3 weeks.
Okay, because that's going to be damn well near Christmas, isn't it?
Probably.
Okay. Do they still continue on, even though there's a break in between Christmas? Or...
Yeah.
Okay.
And we're open.
Okay.
We're only closed for a couple of days.
Okay.
So we'll do our best.
It's like I don't want to start it if there's going to be like gaps.
Yeah, there won't be a huge gap.
Okay. Okay.
And when you meet with your radiation oncologist, have you met with them yet?
No, it's the 31st of October.
Perfect. So when you meet with them, they'll talk about what that scheduling will look like. And of course, we won't make any schedule until after the last cycle of chemo is done. Because, sometimes there are delays, right?
Yeah.
You never know what is around the corner, but they'll set up the schedule for you.
So when I move over to radiology or whatever it's called, radiation, do I come back to you for checkups, or just they don't happen anymore?
So you're going to come back to me in 6 weeks.
Okay.
So while you're on the radiation, you're going to see me.
Okay.
And then we're going to talk about what happens next.
Oh, okay.
And then we're going to come up with a plan.
I'm kind of used to people just okay, because when I did my surgery, I had this navigation nurse, and then she ceased to exist, and then you come into my life, and it's like, oh, you're going to end up disappearing.
No, I am not going to become invisible.
Okay.
At some point, I promise you are going to be too healthy for me, and you are going to want to never see me again. And at that point, I will send you back to your family doctor for your ongoing management. But I am still here, and if there were ever troubles in your future, you can call me, or your family doctor can call me, because we are still incredibly motivated to help you get through this.
Yes.
And get on to a normal life.
And you were telling me to do the MRI in 3 months after, and that was 3 weeks ago.
Yeah.
So who do I end up getting? So that because I would still be here in theory, won't I? Yeah. Okay.
I will organize all of that. Never fear.
Okay.
Never fear.
I'm looking ahead.
Yeah, I know, and it is hard because you're in the midst of something which is very intense, but you also have many questions about what the future will hold.
Yes.
So I think the important thing is to focus on the now.
Yes.
And know that there will be a plan and that we're all working towards the same goal. And I will not drop you like a hot potato.
Okay.
I am here for you.
Okay.
Okay?
Because I'm so scared of even touching that area nowadays. It's weird. I feel like I've got trauma or something. Yeah.
This whole process is actually a little bit difficult.
Yes.
Right? So know that you're not alone.
Yeah. I actually feel like if it was to happen again, I feel prepared. I know that sounds really weird.
Well, I think going through this, you are gaining some invaluable experience.
Yes.
In the healthcare system, and also how your own brain works and how you deal with this.
Oh my gosh, yes.
Yeah. So you're doing really well.
Thank you.
And, we're over halfway now.
Yes.
Right through the chemo. We've gotten through the whole first section. So I continue to anticipate you're going to do well.
Brilliant.
Okay?
Thank you.
You're welcome. So you stay here. I'm going to get you a prescription for codeine. Kristen's going to come in, go through the schedule so you know when to take all your medications.
Yes.
I will send some new appointments to my lovely girl at the desk out front.
Okay.
So when you're finished with Kristen, you go to the front, you get the appointments from her, then you get the heck out of here for today.
Oh, that's too funny. Thank you so much.
Okay.
Hello.
Hello. All right. A couple things to go over with you here. So I've got a new medication schedule.
Oh, I'm glad that you've done it like this.
Oh, yeah.
Thank you.
You're welcome. So it's a little bit different, and with this type of treatment, we do start the medications the day prior.
Okay.
So today, because I think your treatment's tomorrow.
Yes.
Yeah. So with the steroid that you're taking, it's still the same medication, it's just different dosages and times.
Okay.
So you're going to be taking this 8 milligrams twice a day. So as soon as you get it, you know, if you pick it up.
Okay, so don't stress about it, just take it.
Yeah,
okay.
exactly. As soon as you get it, you can take it then with the snack. And then again later today.
Can I ask what's the importance of no later than 5 o'clock?
Just because the steroid's going to muck with your sleep.
Okay, so that's what it's about.
Yeah,
okay.
Yeah, exactly. And then chemo day, same thing, AM and PM. And then you're going to take the Zofran on Ondansetron 30 to 60 minutes before chemo, and again that evening.
Are these the same drugs that I was taking just
Same
before?
drugs,
Apart from the tri-pack, I'm not taking the tri-pack anymore.
Exactly.
Okay.
Yeah. Same drugs, just kind of a little bit different timing sometimes.
Okay.
And then you're still on that prochlorperazine or Stemetil. So this one is not going to be as nauseating as the one that you were on. So hopefully you don't have any issues. If you do, though, call that triage line and we'll get you something different for nausea. But she doesn't anticipate it. And then again, one more day of the steroid, 8 milligrams AM and PM, and then you're finished.
Okay.
So this one's a bit more simpler in that the dose is the same every single time.
Okay.
And then with the Claritin, just because this one's likely to cause more issues with the bone pain, probably start taking it the day of injection or the day prior and take it for a full week.
Okay.
So, because I think you were taking it for 2 days, right?
Yes.
So try to take it for a full week if you can. You can take some Benadryl if you have any allergic type reactions to this medication, like rashes, itching, that sort of thing.
Okay.
Because that can happen with the Docetaxel. And then we have some codeine for you as well to take if you have any pain. So these are the prescriptions. So we've got the steroid and the Zofran. You should still have some Stemetil at home if you do need. Zopiclone for sleep you can try.
Okay.
So try taking it, like don't take it right when you're hopping into bed and try to fall asleep. Try to take it a little bit ahead of time and then
So can I have a question about the sleeping light? I'm always scared with sleeping tablet. Does it mean like I'm going to take it and I'm going to be completely out, and if there's a fire in the house I'm not going to be able to wake up or anything like that?
Very unlikely. Like unless you're really sensitive to medication. I think
so it just helps you snooze off quicker, and then if I do have to get up, then it'll.
Yeah.
Okay.
You might feel like, and everyone's different with it. Like I've taken it before, and I've taken 2 tablets at night before, and I can still be wide awake if I need to be.
Okay.
But everybody's different.
Okay.
So, if you are worried, you could certainly start with half a tablet, and if it doesn't work, increase to a full tablet.
Okay.
It's up to you, and just
awesome. Thank you.
See how you tolerate it. It does give you kind of an icky taste in the mouth in the morning, like you've been sucking on a penny all night long.
Oh, nice.
Just FYI. Here's that prescription for that mouthwash. So this one, it doesn't last very long. Like it expires quite quickly. I think within like 2 weeks after it's made.
Oh, okay.
Unfortunately, so that's why she says only to supply a little bit at a time.
Okay.
Some pharmacies will just dump it all on you, so that's not what we want. That's what she's written on here, only to supply 480 mils at a time.
Awesome.
Otherwise, it's just gonna go to waste.
Okay. So
it goes in the fridge. If you have any sores in the throat, you can gargle with it too. You can even swallow the medication.
She was saying yes.
So, but if you don't have any sores in the throat, if it's just in the mouth, you don't have to swallow it.
It does tend to, just like I said.
Yeah. And then here's the codeine prescription. So you can take that every 4 hours as needed for the bone pain.
Awesome.
Yeah. Okay. Any questions with the medication?
I don't think so. I've recorded it, so I
Yeah, for sure.
Because I'll forget as soon as I look out.
It's all good. Yeah. I'd go get this filled at your pharmacy right away.
But I do like how you guys lay this out. It's very good.
Yeah.
Thank you.
Yeah, you bet. And then if you have any questions, you can always call that triage line if something comes up.
Yeah, I think I'm sorted. Thank you so much.
You're welcome.
You guys are so awesome.
I hope this one goes okay for you.
Say thank you to Susan. I forgot to say thank you.
Yeah.
Okie dokie.
Again, same thing. Like if you're having issues with pain and the codeine's not cutting it, call it. Okay.
Yes, I will do. Yes, I generally phone to her assistant line I generally don't do the triage thing.
Okay, yeah.
Yeah. Sorry,
That's
I'm a bit
fair,
naughty. Okie dokie. Thank you. So guys, I am really nervous going into round 4 of my chemotherapy. So I'll do an update tomorrow. Bye guys.